The hope is that Etobicoke General Hospital will never need it. But in case of a COVID-19 surge, a temporary triage tent has been set up outside of the emergency entrance in the parking lot. Multiple triage areas are being set up across the province. The tent here was provided and installed by Global Medic, a Canadian charity that provides disaster relief services across the world. They also set one up at Brampton Civic Hospital, and Joseph Brant Memorial Hospital in Burlington set up a similar triage tent. We spoke with Dr. Oscar Carby, who says it won't be operating as an emergency room, but more of a screening area.
It's not a place where we intend to keep patients on stretchers overnight. That is something that may be a separate plan for our hospital to pursue, but this is strictly a temporary triage area for the emergency department. And the tent will really have a triage station, perhaps some wheelchairs or stretchers to help patients get into the emergency department.
Currently, the three William Osler hospitals are caring for 35 patients with COVID-19. 439 people have received a positive COVID-19 diagnosis at these hospitals, about 10% of the 4,347 cases in the province. Dr. Carby says people are concerned about coming to the hospital right now for other health reasons, but he says they shouldn't be.
Our volumes are less than half that they're normal. Of normal volumes, Maleeha. And I suspect it's because members of the public are apprehensive from attending the hospital sites. To try and reassure people that we're practicing safely, we're keeping patients safe, we're separating any infected patients from non-infected patients, and it's quite safe to present yourselves to our hospitals for care.
The triage tent will be ready for use tomorrow and can fit 15 to 20 patients comfortably. But Dr. Carby says it will only be used when absolutely needed. Maleeha Sheikh, City News, Etobicoke.